Welcome back, everyone. Next up, we have Dr. Mary Reed, who's going to be joining us to discuss strategies for screening and prevention in melanoma.
Good morning. I'm the Chief of Cancer Screening and Survivorship at Roswell. I am going to be talking about screening, but I will put a plug in for survivorship a couple times. We have a survivorship clinic. You can self-refer. You can get referred by your oncologist. We offer a lot of support services. We communicate with your primary care doctor. We do a physical, and we get you into, we give you more information because we know there are a lot of residual effects of having been treated, including physical effects and emotional effects. And so we have a really broad program, and you should look us up on the Roswell website. And if you want to come, you can make an appointment. And it doesn't interfere with your follow-up with oncology. So I'm going to just review some of the risk factors for melanoma and strategies for prevention, and talk about melanoma screening, but I'm really talking about skin cancer screening in general. Now, you become advocates for this. You are the teachers in your family and to your friends. If you had melanoma and you kind of know what happens and you want no one else to have melanoma, you have to take information like this and tell everybody. And we have advocates for a lot of other cancers: breast, prostate. Now we're starting to have lung. You become the voice of how to spread the word to change people's habits to get away from getting both melanoma and non-melanoma. So your voice is extremely important. There are risk factors for melanoma: UV exposure, from sun exposure and indoor tanning. And there are so many downsides to indoor tanning that even if it wasn't associated with melanoma, we would really want people to stop doing it from a skin damage standpoint, eye damage standpoint. But it is associated, obviously, moles. And, I'm putting this in the language because, we do a lot of screening. The number of moles, the atypical moles, congenital moles, unfortunately, fair skin, which, I definitely have a family history. My husband was a stage 1 melanoma. Our daughter, we lived in Arizona. She learned from age 0, wear hats and sunscreen and stay out of the sun. And because we know that there is a familial association and familial melanoma. And Dr. Parab mentioned that there are some inherited mutations that can change your risk. Previous skin cancers. So when you've had a melanoma, if it's an early stage and it's removed, you still need to be checked, because there is always a chance that even on a very superficial early stage melanoma, you can get another one, because you have the ability to grow a cancer. We know there are second cancers that melanoma survivors get that are unrelated to their skin. And so it's really important that if you've had a previous cancer, that you continue to be screened. You have great advocates in your clinicians. You have great advocates in your primary care providers to continue to be screened. Age is a risk factor. So the older you get, and when we look at the epidemiology of it, it's more frequent among people who are older. And that is true of every cancer. So at some point, just getting, older, and, it affects all of us. Your risk of any kind of cancer increases, especially skin and solid tumors. And if you've had immune system issues, and this is true of both melanoma and non-melanoma skin cancer, if you suppress the immunity, people who have had transplants, they have a really high frequency of non-melanoma skin cancers that occur after this. So any immune suppression from transplants, leukemia, lymphoma, and so on. And so, again, this is the same message that we give to people who've been treated for leukemia and lymphoma. Now you really have to be surveil for other solid tumors and including melanoma and skin cancer. When you look at, this is standardized by all ages, 100 per 100,000 people, you can see that New Zealand and Australia have a really high frequency, both for men and women. And, you know, they get the double whammy. They get the fair skin, because the predominant population down there came from England. So they're really fair skin, blue eyes, and they have a lot of sun. And the Australians have been really leading the world in prevention of sun exposure for their population. They were the first to come out with total, you know, get total bathing suits back in fashion with hats. And if you go there, you really see how aggressive they are in trying to educate their population. But Northern Europe, and again, North America, you can see that we really lead as opposed to the rest of the world, Central America, Eastern Africa. Now, it's not that these cancers don't form in people with not fair skin, it's just less frequent. And I think the providers that you probably see at Roswell can explain the effect of not having completely fair skin on the incidence of melanoma. We can rely on these guys. I'm gonna, because we've talked a lot about the UV. Again, the world incidence of melanoma by age. And so you can see that really, as you start to hit the 50s and 60s, the slope goes right up. And again, that's because we have fewer surveillance of DNA problems. Our age dampens our immune response. This looks the same for many cancers. Regardless of this, is smoking. And it also bears a resemblance to that 50 to 60 for non-melanoma skin cancers like basal cells and squamous cells. It's around that time that our physiology really begins to change, and that accumulation of all that exposure that we got in our lifetime starts to hit us. And that's true of many other cancers, but particularly with skin cancer. This is the way people like me look at risk for cancer. So when it says tanning beds, tanning with redness, a risk estimate of 2 is essentially a 1 is no additional risk, and 2 is twice as much. So there's a doubling of the risk. Not an 80% increase, but an actual doubling of the risk for tanning with redness, with sunburns. And again, that's an accumulated exposure, 2 to 3 sunburns per year. I mean, I grew up, and it's, I don't have any melanoma or skin cancer in my family yet. I'm still, going to get there, but we used to use baby oil and go to the beaches in Rhode Island and come back and our skin would peel, and we just thought that was hot, So that's why folks in our age group, because I'm in my 60s, we really need to be vigilant. And, I'm looking around the room, and your friends really need to be vigilant because we all had similar habits. I'm always stunned. I lived in Tucson for 20 years, and folks would come from the Midwest and spend, the winter in Tucson, which is essentially like the summer here, and really bake like crazy, and then go home. And that is so dangerous because it's so unregulated, and the sun is so strong there. But that's what happens to Florida and Phoenix and Tucson as well. And again, those blonde hair, red hair, multiple oddly shaped moles, the more moles that you have, the more that these can be risky. Now, there are a lot of folks, and your providers are going to tell you, that have tons of moles, and not one of them progresses to melanoma. So if you start to combine having multiple moles with, sitting out in the sun and getting a lot of skin cancer, your risk obviously goes up. And as you age, that again, your risk goes up. Characteristics related to risk of melanoma. And it's people with a lot of moles that are unusual. And that's, we run some screening events here for prostate and for breast cancer. And the single most popular one is skin evaluations. We can usually do 250 to 300 people a day, and they are booked out immediately as soon as we tell, because people worry about their skin. It's the organ they can see, and which is great. And we've yet to find a melanoma in the last years that I've been here, but we find other things, non-melanoma skin cancers, and some of these funky things that you start to grow as you get older that get evaluated. But again, it is something people are thinking about, and I think it's great. And again, we give a lot of messaging on changing some of those habits that contribute to getting a melanoma. And I don't need to read through these because I think this is, again, but just to reinforce this message. From tanning, skin cancer is the second most common cancer among women in their 20s. And we're really talking about melanoma, and we're talking about non-melanoma skin cancer, which actually changes in the skin, AKs and things like that. But melanoma is, we know that it's because there's all of this emphasis on tanning. We don't look healthy unless we have some tan. I mean, I spend most of my time, if I'm not outside during the winter, I'm in my office, and I'm like the palest person of all my friends, because I don't go outside. I use sunblock. And there are a lot of us that do that, but you still don't look as healthy as the person who went down to Florida for their vacation. And that is a cultural value that we have. And eventually it is accumulating. So we are seeing an incidence of younger women getting melanoma. We see some trends with colon cancer getting younger. We've seen some trends. We think they're not blips anymore of other solid tumors like lung cancer, but this is definitely a real trend. Tanning bed users under the age of 30 increase their risk for melanoma by 75% because they're really religious about it. They think that it means that you can tan and then you can go out into the sun and you don't burn, but you're hiding your burn. And so for anyone with a young person they know who uses a tanning bed, you really have to send a strong message to them. And again, it's about accumulation of damage. And we think this is funny, but this is what people go through to have a skin tan. And again, it's really high value. You notice it because I'm not from here, I notice it very much in the culture in Buffalo with a dark tan, especially in the wintertime. For non-melanoma skin cancer, again, the incidence of these cancers really start to increase when you're in your 50s and 60s. They're usually in sun-exposed areas. There are some environmental factors which contribute to non-melanoma skin cancer, arsenic exposure and smoking and radiation. In the South, where you get a lot of arsenical pesticides, farmers, and they do that here too, get exposed to arsenic, and that contributes to some things in the palms of the hands, and also contributes to non-melanoma skin cancer. But again, any kind of constant damage to the skin from ulcers and other skin diseases, and obviously there's a genetics that play a role in having prior skin cancers. So in terms of prevention, I actually worked on an element called selenium for many years to prevent skin cancer, non-melanoma skin cancer. We had multi-centers around the South for the most part, and it didn't do anything. But what it did show, and I met a lot of really senior dermatologists down there, is that where they had folks working on farms for their whole life, starting at the age of 5, and their left arms would be covered with non-melanoma skin cancers, where their right arm, because the left arm hung out the window of their trucks, it is an accumulated event. And so, we think we can't even get enough sunshine to see the eclipse, but we do get in the summer a lot of sun exposure. So again, it's minimizing that damage and the accumulation. The other thing is, it's not as if non-melanoma skin cancer doesn't have issues. It can spread. It can, you see friends and people who've had surgery around very wide margins, because that, especially squamous cell, has spread, and it is not a benign lesion. And that's why when you go into the dermatologist, they also treat those lesions very seriously. And the importance, obviously, is for the early diagnosis. So I promised, I was going to add a picture of my brother-in-law's heel. Okay, so he lives in the UK. He's a big guy. As far as I'm concerned, he's never been in a bathing suit tanning on a beach, but he did have a melanoma diagnosed on his heel, and it was like a dirty splotch that he had for 8 years, until finally he was with a clinician to treat something else, and they said, "What's that?" And they biopsied it, and it was one of these melanomas that should not metastasize, but it did metastasize up into a lymph node in his groin. And I was like, Roger, you had it for 8 years. Why didn't you do anything? You go to the doctor? And it was just, I think, somewhere in his subconscious, he was really worried about it. But fortunately, they found it. He's went on to immunotherapy. And, he seems to be doing pretty well. He has some severe side effects from having had the lymph nodes microdissected or dissected. And while they were doing a PET scan, they found a prostate cancer, which they also treated. So, paying attention to providers. So with you are in a good system where somebody's watching over you, but you need to really be diligent, again, with how you message to your friends, to not sit back and think something's going to go away. They should have it looked at, just to rule out. When you go to the dentist, your dentist is looking for lesions in your mouth. Your eye doctor is looking for lesions in your eye. And your primary care doctor should be doing at least, if you're not coming here, to do a skin exam. Because again, early detection really changes the stage of treatment, and that changes the consequences of treatment and survival. I don't want to belabor the point, but using broad spectrum sunscreens, avoiding long periods outside, seeking shade, and staying out of intense exposure. Long sleeve shirts, you can get them. They're stylish. They prevent exposure on your arms, and avoiding tanning, staying alert to your changes in vision, and wearing sunglasses for UV protection. And again, this is just a repeat of the message, but there are a lot of things that you should start young and cover up. The other part, and I'm not going to read all this, but it's really about knowing yourself and paying attention. And, we're not really great as a society in telling people you need every part of your skin at some point evaluated, from your back to your genitals to your hair. Those are the ones you want to avoid, but melanomas can form in those areas, the non-sun exposed, and you need to pay attention, and you need to send this message to your family that they need to pay attention, and go to a provider that they trust and have a full exam. That's what early detection is about. And anything suspicious, I work with firefighters who also are at risk for skin cancer because they spend a lot of time outside. I mean, that is that cultural group, they don't want to talk about anything. They don't want to whine about something that's been irritating them for a long time, but it's really important to have it looked at. And then it's great if someone can tell you that it's not important and it means nothing. That's the reward of bringing something up. And, this is what doing a full body exam is about. So I'm sure if you've been coming to Roswell, you are probably more of an expert than I am in this. But again, I really encourage you to be the advocates and talk about it in your group and in your family, amongst your friends. And the other thing is that if you're interested in coming to our clinic, we have a lot of access to a broad spectrum of support services, from physical therapy to nutrition to any, alternate. We do some integrative medicine, but we really do try and get you engaged into anything you need that is a consequence of being here, because we know this isn't just a normal walk in the park. So if there's anything you need, please reach out to Survivorship. We have a great team. We have a clinic here, and we're opening a clinic out in Amherst to make it convenient. And it's called Survivorship. And I'll take any questions, and I thank you for inviting me.